Hello, I'm speaking today with Serban Sirca, who's a fourth-year dental student at the Faculty of Dentistry at the University of Toronto. And we're going to be talking a bit about job shadowing. We're going to be talking about role models and giving back and how he's made his decision about what he wants to do next year. So Serban, maybe you could tell me a little bit about what you studied before you went into dental school?
Of course. So I did my undergrad at the University of Western, and it was in biomedical sciences. I had a lot of physiology courses, took a lot of embryology courses as well. But I knew pretty early on that I wanted to be a dentist. Probably at the end of high school, I sort of solidified that decision in my mind and knew that was the path I wanted to pursue.
And did you do any job shadowing before you applied to dental school or while you were in dental school? And did you find that to be helpful?
I did actually. I was very fortunate enough to be able to shadow at a general dentistry practice here in Toronto. I started off in high school, continued it throughout my undergrad. And at the beginning, I really wanted to answer the question if I could see myself doing this every day. I believe I shadowed almost every day for about a month to really, see the day in, day out sort of thing and not just be, blown away by the novelty of going just for one day. And it was really helpful. I formed a connection with the dentist I shadowed, and I was able to sort of ask her about the lifestyle of dentistry. How did she, feel about her career choice? Did she have time for her family and friends and hobbies and all those questions that I was sort of asking myself? Is dentistry the right career for me? And then after that, going back and gaining some more knowledge, I was able to, understand what was really going on when she started a procedure. I knew the names of things, and I was able to ask, for tips and tricks, the things that they don't teach you in textbooks and in lectures, and that are really helpful in the day-to-day life of a practitioner. And sort of you only really get to see that from getting to watch someone who's got 20 years of experience under their belt and who is willing to step into the role of a mentor and to sort of answer the questions that a little clueless wallflower like me might have. Another thing that I thought was pretty helpful out of this mentor relationship is that I was able to, how do I put this, to sort of imagine what I would want to do as a dentist and as a general dentist, as I later decided, but to sort of see the human side of dentistry, to see how she interacted with patients, the relationships and bonds that she formed with them, and I could really sort of see myself fitting into the shoes of an individual who's able to do that and to sort of know that it was the right career for me in terms of being able to also, how do I put this? In any healthcare field, I suppose there's the role of empathy and being able to to communicate well with the people who walk into your door, and having that mentorship and having the example of the dentist that I shadowed, it showed me the right way to do things, I suppose. Which going back to what I said earlier, it's impossible to read from a textbook and learn the 5 principles of ethical dentistry, but you really have to see it to know it, I think, and that's another helpful thing that I got from the mentorship.
Well, and it sounds like a wonderful experience, and it sounds like a good fit of a situation. I imagine that in other circumstances, people who job shadow may decide that they are looking for a different kind of a practice or a different sort of a practice environment. What have you decided to do next year?
So next year, I'll be, fingers crossed if nothing gets delayed, I'll be a new graduate dentist. Um, and what I decided, let's say about a year and a half ago, that the decision to specialize or not would be postponed for later. I sort of fell in love with a little bit of everything in dentistry, and I couldn't really say I disliked any of the aspects of it. So I thought, maybe general practice is the right decision for me. And if, I get a lot more experience and I decide that there's one part that I really, really love more than the others, I can always come back to pursue specializing. And then I came to the question of, okay, do I go directly into private practice or do I do a GPR? And sort of a lot of the other experiences I had along the way, the mentorship I did, and sort of even some of the patients that I've had at the school led me to believe that I sort of could contribute more to the community by going into practice right away. The thought of doing a residency, I mean, it is giving back to the community, but I wanted to really sort of go somewhere where, like an underserved community where I really could see the positive impact I could have right away on the community. I had patients who like commuted from very far away to be at the school, who talked a lot about living in a rural community, and there was maybe one or two dentists that were unaffordable for them, or that they just didn't get along with, didn't see eye to eye with, and they had to commute very far away to be at the school. So I figured out pretty early on that I didn't want to stay in the big city where there's a million other dentists, and I wanted to go somewhere further away where, I mean, I could also get the experience that every new graduate knows that they need, but that I could also see right away that I was sort of fulfilling the mission I set about on early on, deciding to become a dentist and be a positive impact on the community, and really get to help people, help individuals who were a part of the practice.
How has COVID affected the dental school program? And I guess I was going to say, what positive outcomes do you think have come from that?
Mm-hmm. So the two biggest changes are the pace and the structure of our education. Before COVID, I think we had 6 or 7 clinical sessions where I could do a filling, I could start a root canal. Now we have assigned rotations. It averages out to about once or twice a week. A lot of that sort of forces us to prioritize treatment plans and patients. It really gets you thinking, what's the most urgent thing? What is the most prudent and effective treatment plan that solves all the patient's needs given the constraints of the situation? And another part of that is timing. It really forces you to, do a good job quickly and not, think that we've got the luxury of X number of months left. There's no rush. There's no point to doing anything too quickly. I can take my time. I can wait for 20 minutes for an instructor for one little piece of advice. Now we're really focused on coming fully prepared, getting all the answers to those little questions ahead of time, and really being able to sit down and do dentistry, as much of it as we can in the 3 hours that we have. The second change, structure. One major change that U of T did this year is that every third year is now paired with the fourth year. And the patient rosters are joined together, and we sort of divide up what procedures each of us is comfortable doing. And it really is an opportunity for the third years to sort of get some experience by observing how their fourth year the student works. But it's also unexpectedly, it's an opportunity for someone like me, a fourth year, to being in a teaching and mentorship position for the third year. Some of that comes down to the very mundane questions of how do we use the computer system, and what form do I do for this patient, and what instructor do I go to get this approved. But a lot of it is procedural. Why do I fulcrum here instead of here? How can I make the patient more comfortable? Why am I using this material and not that material? And learning the theory is one thing, and it's easy to answer a multiple choice question about that. And then you sort of do it a couple times and maybe even forget the reasoning. It just becomes a reflex. We go to step A, then we go to step B, then we go to step C, and that's the end of it. But having someone sort of sitting over your shoulder asking you that, it really makes you think, okay, like, what am I doing to make this patient comfortable? What have I learned that is a reflex to me, but isn't so obvious anymore? And it really made me appreciate sort of the people that taught me along the way. If I was lucky enough, the first filling I ever did, the instructor sort of sat behind me and said, okay, like, the water's dripping over here because you're not doing this correctly. And, the patient would be more comfortable if you did this. It's all the stuff that you can't Google, and no one's ever going to just fill up their slides with this sort of thing. So if I'm lucky enough, to be made aware of all those little things that I was doing, and sort of to question myself, am I doing everything I learned? What more can I be doing? Why am I doing this? And second of all, to sort of put it all together for somebody else, to give it structure, and to sort of to see them, of watching them, starting to probe and scale and do all that, to really see them putting it all together, and that I helped somebody. Even if I managed to make their patient more comfortable, and got them to learn how to do it even 5 or 10% better, it's a good feeling. And I told her this too, like, all she has to do is pay it forward. I hope the school sticks with this structure of third years being paired with fourth years. I think it really helps. You get to know all the patients. You get to see a lot more just by having 2 rosters put together. But it's a great mentorship opportunity, and even just that 1 year of extra experience, it really does make a difference. And if it'll be even greater to talk to her next year and see her having the benefit of mentorship and a year of experience, and really what a positive impact and sort of a feed forward effect that can have on the education at the school.
It seems to have elements of a general practice model that's implemented at some of the dental schools. And also, I was thinking that that idea that different practitioners may have different comfort zones may be relevant if you go into a general practice where there are multiple practitioners with different experiences, with different interests, where you might be able to consult with other practitioners. You might be able to refer within the group practice that you're in. And I think as new practitioners join, there are always opportunities to mentor the new practitioners into the practice systems, right? The paperwork, the personalities of the patients that they share, tips on working with staff in different capacities that you may not have encountered before. It sounds like a good year so far. So I want to thank you very much for speaking with me today, and I hope that we could speak again in future as you decide on where you'll be, and as you are able to reflect on your first few months in practice. I'd love to speak with you again.
I'd be happy to be here.
Okay, thank you so much.